Meditech has impacted our department of dialysis since its implementation approximately 8 months ago by causing a bit of grief, because change is always a big factor in nursing, and people are resistant sometimes to change. It is a system that seems to be more DOS orientated instead of Windows based, so therefore there seems to be more steps, and it's not visually friendly for the staff and user-friendly. We were designated passwords that were not easy to remember, and you couldn't change them, and so that kind of made it a little harder to remember because it wasn't something you selected. I actually still carry my password with me because I can't, it's not one that is easy to remember for me, so I carry it with me so that I can access and enter lab work. I'm hoping that it'll eventually stick in, but still I work part-time and it's something that I can't seem to remember on the spot, so I carry it with me. Entering the lab work initially was difficult because we had to relearn a new name system for all our lab work. So say for example, lights, I wouldn't be used to typing in LYTES. Well, this would be an LYT instead, or CBCs or urinalysis were the short forms. You had to learn a whole new language. So that was an implementation drawback. Although they did have a search engine that you could search for them, still you had to learn how to use a search engine, and so all these things made it a little difficult for implementation. We're still having issues in terms of trying to look up results, and in terms of trending our results, we're not able to do that. So, and we had been doing this as well with our previous system, where we had to manually input all our lab values to be able to get a trend. So that's, we were hoping to find with an updated version of Meditech that we'd be able to trend and not have to do this, and that should be coming, but it hasn't been implemented. An older version had been implemented due to cost, so savings, so we're hoping to get that upgrade, which will benefit patient care if that is implemented, because then we will no longer have to manually input that information, and the risk of errors with manual documentation of blood work will be eliminated. And it has, in terms of finding reports, it can be difficult as well. Now, on the floors, I know that they've been able to, when they're inputting, they can scan the patient name, so that kind of helps in terms of entry of the patient's name and finding the right patient. So in terms of putting in the wrong patient's lab information into the wrong file, sort of by, if you weren't sure what patient that was, that scanning system was a benefit. But in dialysis we don't have that ability, so you're still inputting the name, either the patient name, and then having to select a date, and so that there's still a risk of error there. Overall, I think in the future it will be better, but we're still in the learning phase, I think. In terms of it being a good change for our hospital, I can say that certainly if you'd asked me the first day that I took the training in the first few weeks, I'd have said no. But when you look at the big picture and know that, when all the Meditech system is implemented, so currently we just have lab and partially pharmacy, we aren't fully implemented yet. But when you can see all the pieces together, so in the long term it will benefit. But because currently we've only got pieces of the puzzle and not the whole puzzle put together, it seems broken up. But I think that in the future, when all the pieces are together, it will truly be of benefit. And we just have to be patient. We do have a help desk, so that if we are having issues, we can call, and they will respond to our questions. As it is not a 24-hour system, so sometimes, and or sorry, it is a 24-hour system, but it's not, you have to leave a message so they get back to you. So it's not immediate, I should say. But usually they're quite prompt at getting back to you, and they are supportive.